support in this constant conduct of this occasion. I also extend my gratitude in welcoming all the executives, HODs of Dr. MGR Educational and Research Institute. And I also welcome our motivating and dedicating teaching and non-teaching staff of Faculty of Nursing who have given a wonderful cooperation in organizing this event. Last but not least, I welcome the whole student body, friends, and invitees. Thank you, one and all, for being with us to make this event evergreen in our memories. Thank you and welcome all.
Thank you, ma'am. May I now kindly request our principal, ma'am, Dr. Professor Hema VH, for the inaugural speech for today's webinar.
A very warm good morning to one and all in this online platform. Am I heard?
Yes, ma'am.
Okay. My salutations to our Founder Chancellor, Secretary Sir, President Sir, and Vice Chancellor Madam. And I owe my respects and love to our resource person, Dr. Annapurna Mary, who has consented and having a passion to be to share her expertise to the Indian nursing community. Thank you very much. And with this, we have here MSc students and PhD students who are pursuing their course. So before I delve into systematic review, which our resource person will be speaking on, I just wanted to make a clarity of what is the difference between systematic review and literature review. Is there a difference or are both same? When we see a systematic review, it is a high-level overview of primary research on a focused question that identifies, selects, synthesis, and appraises the all quality research evidence relevant to that question. And the goal of a systematic review is it finds answers focused on a clinical questions and eliminate bias. And it clearly defines an answerable clinical questions recommended using PICO as a guide. And it is a pre-specified eligibility criteria. Systematic search strategy is used and assessment of the validity of findings and interpretation and presentation of the results. And it is a thorough knowledge of the topic, perform searches at all relevant databases, statistical analysis, and it connects the practicing clinicians to high quality evidence and supports evidence-based practice. Whereas what the literature review which we do for writing a research proposal for our MSc dissertation or a PhD dissertation will be more focused on the qualitative summary of what evidences we have got on that particular topic and what is the general topic or the question, and it provides a summary of the overview of the topic, and it takes much less time. A review of literature takes much less time, maybe 1 to 2 months, whereas a systematic review takes more than 18 months. And understanding of the topic is more important in a literature review, and we do it when we present a literature review for our MSc and PhD work. It will be more of a review of literature. We try to find evidences on what is available for our study and what is the gap. Whereas when we do a systematic research, it involves a systematic methodology. We have a question in our mind and we find out evidences, studies, qualitative, quantitative, and from which databases we are doing the search, and what is the statistical analysis, what studies we have included, what studies we have not included. Everything will come into the systematic review. We all know that research itself is a systematic method to find answers to questions, and this systematic review is also the same. We find out evidences. So when we take systematic review, we have three things what comes in the way. One is the systematic review, the systematic synthesis, and systematic analysis. So the meta-analysis involves the statistical analysis of the data, what is available from our review, what we have reviewed. And the systematic synthesis is done more of in qualitative studies, what we are trying to synthesize. and how are we going to present it. So systematic review gives an overview of answers for the question, and it provides us the evidence generation or the synthesis of data what we have. So we have a very renowned person who has done a lot of work in systematic review and who has consented to present. And also madam has given, has suggested that in today's topic, we will stick on to the systematic review, and we can have 2 more sessions on systematic meta synthesis and meta analysis. So God willing, we will take it forward, and we will hear from the expert on the other 2 topics also. Thank you very much for patient listening. We are looking forward to your speech, madam. Thank you very much.
Thank you. Thank you for Dr. Professor Hema, Principal, ma'am. Thank you very much for arranging such a scientific session. And I thank the Vice Principal and Secretary Sir and President and Vice President of the college, university. Thank you for this opportunity to share this platform and the opportunity to share the knowledge and content and the passion with the Indian community of nursing.
Ma'am, sorry to interrupt. We have one more task to be performed.
Okay.
The expert, you will be introduced, ma'am, to the.
Oh, okay.
Yes, ma'am. Now, this is the time to listen and learn from our guest speaker. Hence, may I call Mrs. Agalya, Assistant Professor, to introduce our guest speaker.
Thank you, ma'am. Good morning to all. First of all, I would like to thank our institution as well as our principal, ma'am, to feel proud to introduce today's speaker, Ms. Annapurna Mary, MSN PhD, RN CNE. Ma'am did her diploma in nursing in the year of 1983 from St. Anne's School of Nursing, Tuticorin. She completed her BSc in 1999 from MMC, her MSc in 2002 from SRMC. And also she did her PhD in nursing in the year of 2007 from University of Tennessee Graduate Health Sciences. And also she did many certificate courses, namely certificate in midwifery in the year of 1984 from St. Anne's School of Nursing, CTFNS certification USA in 1995, certificate of critical care nursing 2004 from AACCN USA, certificate of ACLS instructor AHA in 2006, certificate in trauma care nursing from Trauma Care Association in 2006, and also chemotherapy administration certification in 2007 from Oncology Nurse Association. Finally, certificate of nurse educator in 2012. She has been worked in the field of nursing more than 20 years of experience. She started her career as a cardiovascular ICU nurse, then charge nurse, then assistant nurse manager, as well as she is a team member of medical response at St. Francis Hospital. And she worked as an assistant professor at Baptist College of Health Sciences from 2007 to 2012. And then she joined as assistant professor at Lowenberg College of Nursing, the University of Memphis in 2012. Now she is working as a PhD program director in the same university. Her honors and awards, she has been awarded for even from School of Nursing. She had a first rank in School of Nursing as well as in the College of Nursing, as well as she is a gold medalist for best outgoing student in MSc Nursing program and gold medal for best outgoing student for MSc Medical Surgical Nursing from the SRMC University, and target 100 nurses for Shelby and Fayette County by St. Francis Hospital, and Daisy Award for Extraordinary Nursing Faculty from Baptist College of Nursing, as well as she has been awarded for her excellence in Glenage's Global Hospital Research in the year of 2016. And coming to her publications, she has been published more than 22 research paper in referred journal publications and 29 in referred conference publications, 14 presentation in universities across the world. And currently, multiple publications are waiting for many systemic reviews on the way for this year. She has been active members in many projects. Ma'am has received and applied for many grants for her research work, namely ELCON, UOM, Seed Grant, Chorus Grant 2020, Tamil Nadu, Tea and Health Environment Build Grant, and AHRQ. Our involvement in our nursing fraternity, she has been member in many committees such as Student Affairs Chair, Curriculum Committee Secretary, Admission Committee Member, Annual Student Research Forum Evaluator, Tenure Track Faculty Mentor, Undergraduate Council Member, Student Affairs Co-Chair, Curriculum Committee Member, Progression Committee Member, Annual Student Research Forum Evaluator, again the PhD Program Director, Graduate Council Member, Graduate Council Chair, Research Council Member, Tenure Promotion Committee Member, and Graduate Council Chair, Research Council Member, Tenured Faculty Research Committee Chair, and member in Tennessee Conference of Graduate Schools. And also she's been member in editorial board in many organization, society, as well as journal. She has been IRB member in PMH, IRB member in University of Memphis, secretary in Sigma Theta Tau Memphis chapter, and she is a journal reviewer in multiple journals and invited guest editor in the international journal and international universities. She is been a PhD examiner in all over the world. And also, she is a visiting professor in India as well as international universities. And added to her duty of her count, she involved in many creative activities, like she is a writer, composer, and also published many poem books in Tamil as well as English. She is also a Pattimandram speaker. So it is great honor for me to introduce ma'am today for our session. Ma'am is going to speak on systemic review, the art and science of evidence synthesis. Ma'am, please. Thank you.
Thank you. Thank you for such a detailed introduction. Thank you very much. Once again, I begin thanking the President, Vice President, and Principal, Vice Principal, all the faculty of Dr. MGR Research Institute, as well as all the students and faculty who have signed in for this webinar from many states from India, as well as internationally. Thank you for being here. Today, our topic, as Principal Ma'am introduced, the topic is systematic review, the art and science of evidence synthesis. Evidence synthesis is a huge topic. Evidence means research. Synthesis means bringing together, analyzing multiple research studies under a topic or under a problem. So evidence synthesis means a systematic compilation, summarization, analysis of multiple studies under a topic or a problem. When we say evidence synthesis, there are many types of evidence synthesis. We will see it later within the topic. When I explain each one of them, we'll go in detail. Now, why this evidence synthesis important for us? as a nurses, what are we going to do with the evidence synthesis? Do we have our own evidence? Do we have our own knowledge? Do we have our own body of knowledge as a nursing discipline? We have come a long way from Florence Nightingale till today. You and me, we are living and breathing scientific, knowledge-based, research-based, evidence-based nursing discipline today. But if you look back, many years ago, decades ago, it was not the case. So our predecessors from Florence Nightingale onwards, they started to take our nursing discipline towards a scientific journey. Therefore, as a nursing discipline, we have our own knowledge. We have our own body of knowledge. Who created this knowledge? We, ourselves, nurses. We did research studies. We did the conceptual analysis. We did concept analysis. We built the knowledge. We generated knowledge over many decades, many years, and we have gathered knowledge for nursing discipline. Today we can say proudly that we have body of knowledge, which is our own. Some years before, in 1984, 80 to 84, I began my nursing journey as diploma nurse. At that time, our nursing discipline was a medical model. It was predominantly a medical model. So we had lot of or ample amount of borrowed knowledge within nursing. We studied medicine, we studied surgery, we studied medical surgical nursing, we studied pharmacology, nutrition, microbiology, etc., 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 etc. Majority of them were borrowed knowledge. But today, it is not the same case. Curriculum may remain same, but we have our own body of knowledge. Nursing has its own science and it has its own body of knowledge. And we are to create knowledge, synthesize knowledge, and translate knowledge into practice, education, and future research to take the nursing to the next level. Now the baton has been passed to our hands. That's why we have this webinar. That's why we have this kind of knowledge sharing conferences. That's why we have master education, PhD education, in order to develop our discipline towards evidence-based practice. Advancing discipline of nursing for the future is in our hands by generation of knowledge, especially disciplinary knowledge. So whenever nursing students, when they conduct research like master's thesis, doctoral dissertation, the topics, the nurses are encouraged to take nursing topics. Therefore, we can test some theories. We can test the hypothesis. We can generate our own knowledge, nursing knowledge. Every research we conduct, we publish, we share, we translate, build the nursing knowledge. Evidence synthesis, as I have explained in the beginning, it is a huge topic. How this is going to apply to nursing, evidence synthesis and evidence-based practice is a way to go in nursing right now. In academia, which means like universities, college, schools, educational setting, healthcare, hospitals, community, primary healthcare settings, and private healthcare settings, and then research. So nursing education, nursing practice, nursing research, all three inform each other by evidence-based practice, by evidence synthesis in nursing. Evidence transformation is the hallmark of evidence-based practice, which is not a nice to do thing. Few years ago, evidence-based practice was a nice to do. We follow certain protocol and policies in the healthcare setting and the educational setting, academia setting, research and hospital setting. We follow policies and procedures which were set many years ago. Not the case anymore. Quality control, quality care, cost effectiveness, healthcare, health equity research, all these inform healthcare practices, healthcare education. Our nursing education is one of them. So there are many models for translating evidences, synthesized evidences into practice. This is one of them, which is very easy to use. A star model, knowledge transformation. Why I brought this model? To highlight the evidence-based practice is so important. In order to have evidence-based practice, when I say practice, practice is not just hospital work or not just healthcare setting. Practice also involves educational setting, how education curriculum developed. What is the practice of curriculum development? What is the practice of curriculum evaluation? What is the practice of teaching and learning experiences, creating outcome, learning outcomes, quality education. So that is on the education side. Practice side, quality care, cost effectiveness, patient safety. All those are some of the examples. Health equity. All those are some of the examples for practice side. Research, which bridges both sides, practice and academia. So this model shows us a cycle which begins with the discovery research. Where do we do discovery? Usually, majority of the times, the research has been done at the university settings, college settings, academical settings. As we know, research is created, generated by master students, PhD scholars, postdoctoral scholars, and then the scientists, research scientists create, generate evidences. So before even synthesis of evidence, we need some pre-existing evidence. Now, who is going to have a pre-existing evidence? Where we can find the pre-existing evidence? Only from the context of research, generation of research, we can have pre-existing evidences for synthesis. Therefore, research is the foundation for all the areas I mentioned before. Research, although it is conducted in the university settings, college settings, it is also conducted in collaboration with the healthcare setting. Clinical research are hand in hand with the clinical areas, healthcare settings. So once we have existing evidence, now the question comes, what do we do with this evidence? We have done a research. For example, I have Mariana in my screen here next to my picture. Mariana is doing a research. What is she going to do with that research? And how that can inform the healthcare practice, healthcare education, nursing education in particular and specifically, and future nursing research. So that research has to be communicated. The next stage is communication in terms of publication, in terms of dissertation. So publishing is a vital piece before evidence synthesis. So evidence generation, which is research, then the publication is the next stage. Then further stage is evidence summary. There comes evidence synthesis. Synthesis of evidence comes here. Once we have enough evidence synthesis, then we can put those evidences, test those evidences in the practice. So now call the clinicians, collaborate with them, give the evidence to the clinicians, let them test this. That testing phase is known as translation research. It's a whole new research method, totally new research method. And it is called translational research. It's a huge area of research. It stands between the academia and clinicians. In collaboration with both the department, translation research takes place. Now, once the translation research evidence, for example, Ahalya conducted research and she publishes it, and then Chitra Devi takes that study and do a review on it and synthesize the evidence and then give to Parasakti. Parasakti, why don't you test it in your institution? Translate it into practice. They test it and then they approach the administration leaders to make it into practice integration. So before making into practice integration, there is next stage called policy making. So the policy informs the practice. If you go to any clinical setting, you will see ventilator bundle, pressure ulcer prevention bundle, and then AHA core measures. Likewise, there are a lot of bundles, care measures are there. How did they get there? Where they got? They got through the evidence synthesis. And then that evidence integration into practice is evaluated. Then again, that informs future research. So likewise, it goes on as a cycle. Evidence synthesis is a cycle. So in that cycle, in all the stages, evidence synthesis involved. So what's going on with current nursing education? As I speak, in American nursing education is changing. Huge overhaul after 1950s. And it is in implementation right now. There is a changing models of nursing education in implementation as we speak. There is trends in transforming nursing education. New essentials have come and it is in implementation phase. Trends in sustaining nursing pathways, challenges are addressed. Trends in exercising through leadership, shortage, globalization, evidence-based practice is applied. Emergency preparedness of nursing education takes the center stage after COVID-19. Cultural competency-based curriculum administration is introduced as we speak. It's new. It is going to permeate the entire world in a timely manner, but it has begun in United States of America. Cultural competency-based curriculum administration, emergency preparedness implications for nursing education, future beyond COVID is addressed as a very serious aspect, a central, pivotal aspect of nursing education is being addressed. Our nursing education, as I was speaking to Principal Ma'am, Dr. Professor Hema, in the beginning of our conversation, how are we doing clinical during COVID? She implied that they are using technology, video-based instruction they are providing. all over the world has changed the way nursing education is being administered. Simulation was a nice thing to do few years ago. Now no more simulation is a nice thing to do. Simulation is a mandatory for all the nursing education area and settings. Video web-based education has become mandatory after COVID. That will change our curriculum. That will change our administration. That will in turn change our learning outcomes and accreditation. It may take many years to come, but definitely our nursing education, academia setting, healthcare setting has taken a major overall landscape change due to our recent pandemic. This is the new essentials. Heart and heart I am providing you here. It is just has come out, and every universities, every colleges, every school of nursing in United States of America is implementing these essentials from domain 1 to domain 10. If you look at it, I'm not going to read all of them. I'm just introducing this to you. It is so new, so hot, so new. AACN Essentials new. That means we are doing curriculum changes across the program based on these domains. These are new. Some of them are applied from the previous curriculum, but majority of them are new. Among them, previous essentials had essential number 3 was designated for evidence-based practice. Now, look at this domain 1. What do you see? Integration, translation, and application. What does it say? Evidence synthesis. And then domain 3 addresses healthcare continuum, evidence synthesis for the stakeholders. Scholarship for nursing practice predominantly addresses generation, which is research, conduct of research, synthesis, evidence synthesis. It can be systematic review, meta-analysis, meta-summary, meta-synthesis, etc. There are a lot of evidence synthesis there. Then translation, application, so as you can see. So if you see all these domains, some domains have evidence synthesis implied, some domains directly informs evidence synthesis. Now we come to evidence synthesis. Evidence synthesis, as I said, it is applied in 3 areas. Academia, we have just now seen how this changes the landscape of academia, evidence synthesis. Now we are seeing how this is applied, the evidence synthesis is applied in an effective healthcare program in the practice area. So evidence synthesis leads to evidence need identification, and then dissemination and translation, horizon scanning, which means assessing the environment, situation, need for evidence synthesis in a practice setting, and then that informs the academia for evidence generation, career development, research training, plays an environment for the healthcare program, effective healthcare program. Now, Magnet Hospital was a, you might have come across this terminology called Magnet Hospital. Magnet Hospital is a quality mark for any hospital which follows evidence-based protocol and evidence-based research department. They have research department, they do evidence-based practice protocol, quality care, they follow all the bundles. All those criteria they follow, they are given a certification of Magnet Hospital, which is a high standard. Now, all the hospitals now are required to have all those criteria. No more it is just the Magnet Hospital criteria. Every hospital is required by Joint Commission, CMS, and all the accreditation bodies in United States of America require all the hospitals to undergo those standards and follow them for the quality care and patient safety. Therefore, evidence synthesis, evidence-based practice is a hallmark or essential component of healthcare, effective healthcare program as well. This is a huge flow diagram. You can just visualize. I will just speak to the diagram. In the healthcare program, they have various levels of stakeholders. Program phase, engagement purpose, stakeholder interest. So it begins with the stakeholder interest, which means it can be an institution, it can be a university, it can be a college or the school who would like to explore into innovation, an idea, a problem, a situation, need a solution. So they identify an area of a study or a synthesis. Then they engage the academia and the research scientists and experts to collaborate to create, generate, and synthesize evidence. So topic, so they generate the topic, then they develop the topic, leads to topic refinement. Of course, you do not select a topic. I am speaking to master's students and PhD students and some faculty here too. You don't take one topic and take it to your dissertation chair and you have 2-3 meetings with your dissertation chair and your topic changes. And it changes and it changes and changes. You change your topic until you get it right? So it takes refinement, research review, then you go into synthesis. You go take the existing research and synthesize to provide for the existing need in all the places of evidence-based practice. Then research development from the synthesis and report the translation and dissemination. National Institute of Nursing Research is a huge institute which is a funding organization for nursing research in United States. Apart from the NIH, there are multiple institutions fund nursing research, but NINR is a nursing research institute in America, United States of America. They are reviewing their strategic plan. In that they have highlighted translational science as one of the focus for between the years of 22 to 26. So evidence synthesis is a timely topic, no matter where we reside. So NINR priorities have evidence synthesis, translational science, translational research has a priority inbuilt within the strategic plan. Evidence synthesis there are different types of evidence synthesis. Synthesis process, systematic review is one of them, which we are going to discuss today. Meta-analysis is another. In systematic review, quantitative and outcome studies are synthesized. Meta-analysis involves quantitative studies. As it says, meta-analysis, you take data, statistical data, numerical data from multiple studies and draw the data upon your purpose and research question and do a statistical analysis and come with the results and discussion and conclusion. That is a research method itself, meta-analysis is, which involves quantitative studies. And majority of the times it involves randomized control trial, to be specific. But meta-analysis can use any quantitative studies. It can use any numerical data from any quantitative studies. Integrative review. Integrative review is, it involves qualitative and quantitative studies, or even mixed methods, case studies. All these can be synthesized upon a problem or a topic. That is known as integrative review. Many methods will go under that. Quantitative, qualitative, outcome research. When you say outcome research is focused on studying patient care outcome. It involves mixed method, quantitative, qualitative, community-based research method, action research method, etc. There are numerous research methods come under outcome research, process research, evaluation research. So many research methods are there under outcome research. All those things you can synthesize under integrative review. Meta summary, it summarizes existing qualitative studies. Qualitative study is a study of experience, human experiences, and it involves subjective data. It involves inductive reasoning. So it synthesizes, synthesis of qualitative studies, summary. Metasynthesis. Metasynthesis involves original qualitative studies and meta summaries. Summaries of original qualitative studies is known as meta synthesis. Systematic review. Systematic review is defined as a review of evidence on a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant primary research and to extract and analyze data from the studies are included in the review. The method must be reproducible, very important. It should be retraceable, reproducible, and it should be transparent. The word itself says its definition. It is systematic. Systematic means it is a step-by-step process. It has a system. It has a method. It has to be followed. It has a protocol to follow. It has criteria to follow. It is scientific. Therefore, it is systematic. Review. Review means you go back, look back, the previous existing evidences, existing research studies upon research problem and synthesize them. That's known as systematic review. Systematic review definition by Cochrane review. I'm introducing this. Many of you may know this. Definitely MSN students and PhD students would have come across at least once this website, Cochrane review. It is an institution which archives, which consists of database on systematic reviews. So it is worthwhile for you in your free time to explore this website and go inside and see what is the priority they are looking at. For your research studies, master's thesis and doctoral dissertation, go inside and look at there are groups of studies. Look at them on your topic. What are they doing? What are they speaking? What are the reviews available? Include them in your chapter 1 and chapter 2 to inform your research. It will be very useful. Systematic review. If you include systematic reviews in your chapter 1 and chapter 2, your foundation, chapter 1 especially, is the foundation of your thesis and dissertation. And if you followed a systematic review and brought forth the evidences to support your problem, significance of the problem, and what is known about the problem, what is unknown about the problem, what is the gap about the problem, so what? What are you going to do to inform your purpose, to inform your research questions, to inform your methods, to inform your instruments, to inform your research process for the entirety? you can use systematic review. Therefore, I am introducing it to you, this website. Please, in your free time, go in and it will be very useful for you. You can really, you can be really strategically include studies which are very applicable, which are very appropriate for your research problem. So what do they say? Cochrane review says, systematic review seek to collate. Collate means compile, analyze and add. It's pre-specified eligibility criteria in order to answer a specific research question. They aim to minimize bias by using explicit, systematic methods documented in advance with a protocol. Now, within systematic review, you do have different types of systematic review. So, if you see this green color oval, that entirety is research review or evidence synthesis. In that, systematic review is one of them, as I said. Systematic review, you have effectiveness review, comparative effectiveness review. So first, in the general outset, you compile studies. Sorry, my video is getting, I am kicked out of my video. I don't know why it is. So in the general systematic review, upon a problem and the topic, you synthesize evidence, what is existing. In comparative effectiveness review, it is more specific with the numerical data. So significance, you have to establish significance with it. So it may even include meta-analysis within it. Some systematic review consists of a sample of data analysis also inside. So in a situation where they may include a part of meta-analysis, they may do a small meta-analysis, not a strictly meta-analysis, but they may include numerical data and analyze and show. That is a comparative effectiveness review. Comparison between the studies. Effectiveness of the study comparison is done. So it is not just the synthesis, not just the review, but comparison is done across the evidences and to compare them and find the significances and the differences among the studies and under the problem. Then overall effectiveness review also is a broad review. That's a broad review. From the broad review, you go to the specific review and then you use the technology. There are plenty of technological briefing need to be adopted for systematic review or any evidence synthesis. Okay. Characteristics of systematic review. So the scope of review is identified in advance by research question, sub-question, aim. As I speak to the master students and PhD students, in the research world, this is so simple. Research is so simple. Do not complicate it. First of all, you have to identify your research problem to the specificity of the population, specificity of the problem significance. What is the problem? What is the significance of the problem? How many people are affected? How many are dying because of that? How many are having complications because of that? Specific. Be specific. Synthesize all those evidences from the pre-existing research evidences. Before you arrive to research question, your question should be focused by your research problem. Your research question, research purpose, research aim for your thesis or dissertation comes later. Before that, you need to dwell into evidence synthesis with a specific problem, specific population, specific significance of the problem. Then, first you find a comprehensive search to find all relevant studies. Do a comprehensive search. Then use of explicit criteria to include and exclude studies. As you know, you have inclusion criteria, you have exclusion criteria. Then you step by step, first you do a comprehensive search on your research problem. Look over what is out there. Then this is, I'm so excited to speak this topic. This is the most intellectual process of the research. Evidence synthesis is the most intellectual process of the research. As Aristotle said, knowledge is truth, knowledge is beauty, and it's so beautiful. I want each one of you to enjoy that. Enjoy the beauty when you dwell inside that research articles, each research articles. When you read their purpose, their problem, their purpose, then you go into their results and the discussion and the implications, and you take notes on each one of them. Notes on them. It can be electronic or, handwritten. Up to you. Take a note and keep a log. And ultimately you will end up and you will get to a moment where you will be saturated. The data saturation will occur in your cognition and intellectual arena. And there is a beauty to it. There is a taste to it. Please enjoy that. Enjoy the journey of your research. I always say, and my professors used to say, student life is a golden life. Students, those who are here, please enjoy your student life. And one of those enjoyment is this scholarly synthesis. Evidence synthesis is a beautiful scientific journey. Another thing I would like to note here, very important. In India, we are so blessed to have our semesters we take many courses at the same time, but they are stretched to over more than 6 months. So we have a time to read, dwell in that knowledge, understand, associate without a rush. We have a privilege to dwell in the knowledge. So evidence synthesis, we should be in forerunners. Indian nurses should be the nursing academia. Indian nursing practitioners should be in the forefront of evidence synthesis. It takes a dwelling period. So as you see, comprehensive search, then explicit criteria, inclusion, exclusion. In that comprehensive search itself, you will come across your inclusion and exclusion criteria. Let the evidence inform you. Do not force yourself. The enjoyment will come only when you journey with the evidence. The evidence will inform you. The inclusion criteria you will retrieve from the evidence. Evidence will inform your inclusion criteria. Evidence will inform your exclusion criteria. And then you apply the review standards, appraise the quality of each study. We will see in detail in a minute. Then follow an explicit method for extracting the data from each article. Then sometime you may use a quantitative synthesis using meta-analysis as well. Significance, as I have already informed you while I was explaining the previous slide, significance. As a students, MSN, PhD students, evidence synthesis is a centerpiece of your journey, scholarly journey. Scholarly synthesis, for example, in chapter 1, you are writing your research problem, your significance of the problem, your variables, You are defining your variables. You are looking at all the associated concepts. You are looking at the significance of the problem. You are looking at the research gap. And from the research gap, you are bringing your research purpose and aim. All this involves evidence synthesis. Then in chapter 2, you go in the chapter 2, then you elaborate on research problem, concepts associated with the research problem. You develop your conceptual framework. You define conceptually, operationally all your variables, and you identify your instruments, you identify your method, you identify your outcome. All that entails with the literature review piece of your chapter 2. Chapter 2 involves evidence synthesis. Then you go into method section. Then you go into data analysis. Then you go into discussion. Then you come to discussion again, you go to evidence synthesis to compare and contrast, to do the discussions. And then again, conclusion. You come up with a conclusion. So every stages of research process, you need evidence synthesis. Systematic review has limitations. The limitations are, it is narrow, focused on research question at hand. The data out there on the research problem may vary, so it is limited. Systematic review. Systematic review, you include a lot of research studies. We need to assess the quality of the studies before including into evidence synthesis. So we need to know which one is the most quality method, quality rigor and internal and external validity criteria met method, and which one is the least method. Upon method, systematic review and meta-analysis of RCT comes number 1. Gold standard, number 1. So that tells us systematic review stands number 1 in the evidence. Of course, RCT, when you include studies, RCT number 2, randomized controlled trial, quasi-experimental design 3, case control studies, cohort studies, all other, you can generally call this as any quantitative studies which has no experimentation is called non-experimental studies. All quantitative non-experimental studies comes under level 4. Systematic reviews of qualitative descriptive studies are number 5, and then qualitative descriptive studies number 6, 7 opinions of the authorities. Systematic review is a research process by itself. In the research process, what do? We formulate research question, define the purpose, review literature, related literature, formulate hypothesis, select the research design, select the population sample and setting, conducting a pilot study, collecting the data, analyze the data, communicating conclusion. Same thing applies in systematic review as well. So first, your systematic review process overview, prepare the topic, identify the criteria, extract data from the studies, then analyze and synthesize studies by assessing quality of the studies, assess the applicability of the study, present findings, synthesize quantitative data, grade strength of evidence. Grading the strength of evidence is what just now we saw, the levels of evidence is a must. For when you do the evidence synthesis, you need to assess each evidence because you are informing practice, informing research, you are informing the academia by evidence synthesis. So you are assessing the quality of each study. Upon the quality of each study, you are recommending. Systematic review steps and process. There are 7 stages and steps. First, identify the research question. I always tell my students, whether it be BSN students, MSN students, or PhD students. When in doubt, where do you go? When you are in doubt about any research, where do you go? The answer is always you go to the research question or research purpose. The study should be viewed, reviewed upon the research question. So likewise, anything you begin, you should have a question, research question. And then you define your inclusion and exclusion criteria. Then search for the studies in the databases. Then select the studies, extract data from each study. After extracting data, assess the quality, synthesize, and report the results. These are the 7 stages. We'll see each one of them. Identify research question. Research question. These pictures all I have developed and devised for my teaching purposes. It's all my own. You can see my name there. One day I look forward to have it in the handbook. My students here in United States itself, they are telling me, Dr. Mary, put all this in the in a handbook. So research problem. First of all, research question should be addressing the research problem. From the problem, from the population, you develop a research question. Next, after selecting the problem, review the pre-existing studies and know the significance of the problem. What is the significance of the problem? So, for example, dysfunctional ventilator weaning response is a problem among ventilated patients in critical care. And that is a problem. Dysfunctional ventilator weaning response is a problem. What is the significance of the problem? Then, many studies may say the numerical incidences and prevalences of the problem. It may say, for example, 40% of ventilated patients develop dysfunctional ventilator weaning response, which is the significance of the problem. Another significance may be, out of 40% of dysfunctional ventilator weaning response patients, 20% of them have prolonged mechanical ventilation. 3% of them have mortality. 10% of them institutionalized, require long-term care. These are significance associated with the problem. What are the, in general to say, who is affected, how they are affected, who all are, what happened, so what? Because of that problem, how many people are affected, how they are affected, what are the complications going on, how many people have facing mortality, morbidity. Those are significance of the problem. Next, after knowing all that, then look for the studies, what they have done about that problem in existing studies. What are the research gap? Identify research gap. What is unknown about the problem is research gap. For example, dysfunctional ventilator weaning response has been studied widely among critical care adult patients, but it is not studied among pediatric critical care patients. Which is not studied is research gap. So that's the research gap. Likewise, there may be multiple research gap associated with one problem. You select one of them. You identify many research gap and place them all in chapter 1 before your purpose, and then select one research gap and develop your purpose statement and research question. Now, the research question should have a format. What is the format? It should have a problem, population, intervention, comparison, and outcome. Population means people upon which you are going to study, who are involved in that problem. Intervention, the researcher does some manipulation to the subjects to effect a quality outcome. Comparison, you keep comparison in order to increase the validity of the findings. Control for bias, there are a lot of bias. So in order to control bias, we need comparison, and then you need to have a specific outcome, which it should be specific, measurable, recordable, reportable, reproducible, and it should be time oriented. We call it as PCORD question. Today, after this, with your dissertation chair and your thesis guide, you discuss your research question, or even you take your own research question and purpose to see whether you have these components within your research question. If you have a good clinical research question. Systematic review also should have a research question upon population, intervention, comparison, and outcome. Then now you search the studies. First, you look at the databases. For nursing studies, you have a lot of databases, like Sinahel is one of them. EBSCO is another one. Medline, it's a medical database. We can also use that. So likewise, there are a lot of the Cochrane, AHRQ, there are a lot of databases available. You can use any one of them. So once you have identified the database, now you are in the process of accumulating pre-existing studies upon the problem. Next is data source. Now you need to really evaluate your data source. There are different types of data source. For systematic review, you need primary data source. Primary data, as you know, primary data means the research has been conducted and the report has been written by the primary author. The research study report has been written by the researcher who conducted the study is a primary data. Systematic review, majority we need to have a primary studies. Then data type. Data types are many kinds. Conceptual data, database, research data. For the systematic review, you include research data. You do not include conceptual data. You include research data. Research data comes from research studies. How do you know research studies? In general, how do you locate the research studies? I'm just going to simplify here. You can close your eye and say, look at an article and look for these sections. Introduction or background should have a purpose. Method section is a hallmark of research study. Should have a method section, and it should have a data analysis section, should have a result section, discussion section, conclusion section. All this intact is a research study. No matter what kind of research study it is, that it is a hallmark sections of research study. So easy. When you look at the article, when you look at the abstract, look at the method, design. It should follow research design. Then it is a research article. So these days, there are a lot of predatory journals. There are a lot of research articles without verification being published everywhere elsewhere. It is so hard to find a really good research article. That's why you have to go to the database, which is a peer-reviewed database. And the primary data and data type should be research data. Once you have found the data source, identify data type and refine search again. Identify more articles. When you find the articles, you do a search log and selection of sample size. You select articles for your review and sample size. General rule of thumb. Just follow research significance. When do we have minimum significance? What is the sample size for minimum significance? Is anywhere above 30. Anywhere above 30. For example, randomized control trial, anywhere above 30 number of, we have to do power analysis for that research study, but anywhere above 30 subjects, you can measure significance. You can start measuring significance. Not necessary it will show you significance, but you can start measuring significance. 30 in experimental group, 30 in control group. Same principle you can apply here as well. Systematic review also should have enough number of articles to inform your concepts built in within your research questions. So anywhere about 25, you should have, in order to call it as a systematic review, you need to have anywhere about 25 to 30 articles in it. Then you can call it as adequate sample size. Okay, we have seen this star model before. Now, why I have this here? When you select research studies, if your purpose is conducting research, then go to the Senegal databases. Where do you go? Bibliographic databases, Senegal, provided sites and multiple reports, research reports, all that you add. When you do evidence synthesis, like systematic review, you go to Cochrane collaboration database, systematic review. So I have provided the website there. That is the appropriate site to go and look for research articles. Authenticated research articles. You can't simply go to any journal and pick up a research article and say it is a verified and validated research articles. In order to include within the systematic review, we need to have a validated research articles. So if you go into these databases, your research articles are validated. I encourage my students, master students, even BSN students, master students and PhD students to go to this website. First, to begin general search, I ask them to go there to study about their problem. Next is translation. If your purpose is if your evidence synthesis for translation of research, then you have National Guidelines Clearinghouse sponsored AHRQ, national site, national guideline.gov site. Integration into practice, then you have AHRQ site. Evaluation process outcome research, National Quality Measures Clearinghouse website. So these are different websites. Archive validated research studies with these purposes. When you select studies, you can employ software. Talk to your librarian, talk to your technology savvy person, see how you can integrate technology in the process of selecting studies. So the technology can screen your studies with your research questions. There are various technologies available now for systematic evidence synthesis. Involve them, include them. Selecting studies, first step, go through the title and abstract, scan the study, skim it. And then second step, you go by each section of the study, introduction, background, purpose, method. You thoroughly read and take a dwelling time and associate your research question for the review with the article. You are the researcher. You are the scholar. You are doing the evidence synthesis. You are in between your research question and this article. So dwell in this space and take down, extract data from the study. Guys, it's a very intellectual process. You will enjoy it. You will really enjoy it. Extracting data is a systematic process. It should be consistent and it should be reliable and retraceable. Data collection is the next stage of systematic review. So you collect data from the research studies. Do not include reports or opinion column or somebody else's expert opinion. Do not include them. Systematic reviews have research studies. Synthesis involves research studies. And data sources are available and there are trial registrars are available. You can go find the registries and include them. Review authors and develop outline and table and figures for the literature review matrix. Develop a matrix. Therefore, you can systematically, consistently take information from each research article and archive within your table. Table it. Then identify data. If you need to do a data analysis, identify numerical data. If there are incomplete data, you need to contact the researchers. When you do meta-analysis, you better contact the researchers for the ethical purpose as well as complete purpose, accuracy purpose. Because research article will not contain entirety of the data. When you have to include data analysis, you have better contact the author. Mandatory observation when you do the systematic review. Identify all relevant parts of the research study. Assess the risk and bias built within the study. Examine any relevant retraction statements, errata for information, clinical study registration, regulatory reviews. I sit in IRB, Institution of Review Board, in a huge hospital, which is called, we have 14 hospitals under one umbrella. My university is, engaged with that IRB. So I am IRB member representing my university inside that IRB. We review studies, national studies, multinational studies, international studies. One of the process what we do before going into IRB review, we review the author. We review the registry of that study. We review any retraction statement. Retraction statement means any untoward event or any erratic events happened with this researcher in any other study, in this study or any other study. We look for all those things before, background check. We do the background before even reviewing the study at hand. That's called errata for information. The registry will tell us. There are registries for clinical studies, clinical trials. Then we can go in the registry and study about the author as well as regulatory reviews. IRB review is one of them. IRB is a regulatory review. And IRB overseeing studies is a regulatory review. So all those details we need to pay attention to those. It is not just simply reading the article and taking information and compiling. It takes a lot of systematic steps. Journal articles are used Within systematic review, do not use any report or any other than research studies. Of course, sources have to be valid. I have explained that very well in the previous slide. Some of these, and you can use data collection, either paper form, electronic form, or data systems. There are systems available for doing systematic review. You can use them. Checklist item to consider for data collection. Information of the report, including author information, type of the study, then the eligibility criteria, study design and method, population setting participants, intervention, integrity of intervention, process evaluation, outcomes, results, miscellaneous. All these need to be evaluated within each study. If you are including 30 studies, you print all those. Once you have selected the studies, print them, read them, highlight all this, and then take down in the extraction table of this information. So when you take information, there are two types of tables you will have. Number one, evidence table. Evidence table means a table with all the required information summarized from the article. You take from the article, it's a data. So you are not changing anything. You are not synthesizing there. You are taking the data and you are making it, it's a data. You are collecting data into a table. So that table is known as evidence table. Another table is summary table. This is your work. You analyze each information you have taken within the table and you synthesize. You compare and contrast and compile and summarize across the studies. And then you synthesize. Synthesizing table. So you have two tables. You may have evidence table, summary table. If there are some qualitative researchers here, you may agree with me. When you read 2-3 articles itself, you will get theme. You will start getting themes. Repeated, redundant themes will start to appear when you start synthesizing, okay? Although it is a systematic review of quantitative study, but the qualitative researchers here present, anybody, would agree with me. When you read repeatedly on the subject, many articles, it will inform you, it will evolve, and you will get that summary of synthesis. What data you collect? First, you describe the study, then you assess the outcome, describe the outcome as well. Describe the risk, bias, and applicability of each study, and if needed, conduct meta-analysis. Use the, how do you extract data, and your research question should be in P-code model. That's a systematic clinical question. Majority of the times, evidence synthesis we do for a narrowed purpose. We have a research question upon which we do review. So P-code is the format: population, intervention, comparison, outcome, timing, study design. It's a self-explanatory. I don't think I need to explain this to a master students or PhD students. For the completion purpose, population or the, it can be, these are the people upon who you study, to whom you are going to apply the study finding. Then intervention is your experimentation. Comparison is the group with whom you compare, the group who do not receive experimentation. Then your outcome. What is the outcome you want to achieve by this synthesis? Timing. For example, within last 5 years, there are a lot of changes in the healthcare industry. Internationally, we cannot simply say it is in United States or in India or in Malaysia or Kuwait or anywhere. It is global. We live in a global community. Changes happen fast and it translates fast. So now the timing is so important. Time is a criteria and an indicator which will determine the practice and the policy as well. Study design, study setting and design also should be paid attention. And here you go. What is population? I let you look at it. 1 minute silent. I have explained already. Okay. If you have done, you can go to that participants and show your tick for me. Show your hand like that you have done. I can move on. Okay, I'm looking at the participants. I'm looking for hands, just hands. Just wave. That means you have gone through this slide. Good. Thank you. All right, let's move on to the next slide. I've already explained this, therefore I don't need to repeat. Shall we move on? Okay. Next. Okay. Data collection protocol review. In summary, the method section of both the protocol and the review should be detailed. The data categories that are to be extracted, how we extracted data from each report will be verified. Therefore, you have to make your extraction chart, that literature review matrix, and your synthesis from that should be transparent, visible to the public. Whether data extraction is undertaken by content area experts, methodologists, or both. Data extraction cannot be done by anybody and everybody. The data extraction has to be defined and it should be done by the experts. Here, you are the expert. Pilot testing. First, you select few articles and do a pilot testing, synthesize, and then you expand your search. So you also write about how you extracted data, what were your inclusion criteria, what were your exclusion criteria, why and why not, what is the rationale for selecting inclusion, what's the rationale for exclusion, and therefore how did you handle the disagreement? If there are multiple researchers involved in the review, how do you handle the disagreement? And then, for example, why did you exclude certain studies? For example, did they not have enough sample size, therefore you excluded? Did they not address your method, therefore you excluded? So just to describe all that within the method section. Remember, systematic review has an introduction section. It has a research question. Then it has a method section. In the method section, you need to write about database. What are the databases you accessed? What were your search terminology? What were the inclusion criteria? What were the exclusion criteria? How many total number of articles you had? For each search, you need to keep a log for each search. And how did you determine which article you would keep? You need to narratively write your method section. And finally, how did you determine to keep the articles? Those articles you selected, why did you select? And how that informs your research question. associate, compare and contrast and write the method section. Then you have to also write about quality appraisal of the article. How did you appraise the studies? So you have to write about the quality appraisal of the article. So how do you assess quality? First, you look at the method section. Method associate to the purpose of the study. So when you associate method with the purpose, you are like a detective right now. A research study is in your hand and you are taking it, and it's a very interesting process. Look at the method, associate with the purpose. Remember, when in doubt, go to the purpose, go to the research question. The study has to follow the research question. So the method has to be derived, or it should answer the research question. If the study is to focus on the purpose of the study is to find the association between the variables, then the method should be correlational study. If the study purpose is to describe the characteristics, then the method should be descriptive study. If the study is to test the effectiveness of something, then the study should be experimental study. Among the experimental study, if the purpose is to have a control and a comparison group, then it should be randomized control trial. If the study purpose is to study the human experiences, then the study should be qualitative study. Likewise, I can go on like that. The purpose and the method should match. The purpose is at the top and the method should align with the purpose. That's the first check for the quality. Then you check the purpose, the components within the purpose. Is that addressed within the measurements within the method section? What were the instruments used? Are they enough to measure? Are they accurate, appropriate, content validity, construct validity, criterion validity? Does it have validity, reliability? All that, assess that. Once you have done that, now you go to assess general validity of the study. As you know, you are master students, PhD students. I don't need to go deep in the lecture on that. You know, there are threats, internal validity threats, external validity threats. Internal validity threats are the bias which comes with the method and the conduct of the research. External validity bias comes with the application of the study. So for example, let's take cooking. A tasty if you cooked a tasty recipe and then you served at the table, if you cooked following a recipe or you follow your mom or grandma's recipe and you cooked, if you cooked according to the recipe, then your food will be tasty. Same thing here. If the researcher followed every step and criteria for the method and the process and conduct of the research, and then they had an accurate, reliable, valid instrument and measurements and data analysis, all that apply to the purpose and it is absolutely perfect, then the results are going to be unbiased. Good result. Okay, we have good food, therefore you can not only eat by yourself, but also you go and share with others, right? That is what external validity is all about. If you have an unbiased result, it can be applied outside the subjects and the setting. Okay, beyond the study subjects, beyond the setting. If you are able to apply study findings, then the study is said to have external validity. You know the specific threats. So apply those criteria and identify whether they have threats. For example, let me say one example. If they have randomized control trial, that study is about randomized control trial, then the study has a control for sampling bias. Whereas if you have quasi-experimental design, you may not have control for sampling bias. If they have done power analysis, they have control for sampling bias. If they do not have power analysis, they have threat for sampling bias. The results will be affected. This is just one example I'm giving. There are lot of threats like that. Instrument can have threat. Method itself can have threat. A threat can come from anywhere. So assess all that and then find the reliability of the study, applicability of the study, and then therefore you can synthesize. So before synthesizing, look at all these things. And in the method section, you will write, you will also give a narrative quality appraisal of the study. Do an intellectual research critic. Merits, limitations, meaning, and significance of individual study you included in research evidence. So as I said, look at the research problem. Is the problem was significant? Or simply they want to study? Simply they want to get a degree? Okay? Therefore, they went and did a research. How do we know our problem statement is significant? Our problem statement should be based on clinical problem or education, nursing education problem, research problem. So all these things should be, it should be significant to nursing, ultimately. Then what are the major strengths of the study? Assess the strength of the study. Is it randomized control trial? We have strength. Is it a quasi-experimental design? Then you have experimentation, which is a strength, although it has other bias. But if it is a convenient sampling in a study, that may be a bias. It consists of lot of bias. The study. And then is the methodology sound? Is it a sound methodology? You have sound methodology. And remember I said how to assess method with the research purpose. Whether this study can be replicated. How this can be, whether this study is useful, first of all. You include the studies only which can be used. Intellectual critic guidelines. Read critic entire study. Okay, we have gone through this already. I give a minute for you, a second for you to look at it. We have gone through that. Then you are now writing the results. The seventh section of your systematic review. You are writing the results. So in order to write the results, you need to synthesize. The synthesis can be two types: explanatory synthesis, argumentative synthesis. Both the type writing, you need to support those writings with the evidences. Okay? When you write, this is how you write. You write the head sentence. What is this about? First of all, you organize. How many of you, although I'm speaking about systematic review, this process may be very familiar for qualitative researchers. How many qualitative researchers I have here? Please raise your hand. If you have, show me your hand, please. If any. Okay. You read and reread and synthesize. And you find the themes of results of each article. Now, when you synthesize continuously, you will come up with major results. like 3 or 4 results within that synthesis. Make them as a heading. And then now synthesize upon those headings. Take it as a code. And upon those headings, you organize the study findings and make it synthesized. So you write a head sentence and then you provide evidence for it, explain the concept, provide evidence, provide a conclusion for that concept, provide evidence. Then you transit to the next statement. So you have explanatory synthesis and argumentative synthesis. Argumentative synthesis means you are defending something. You are defending something. Explanatory synthesis means you are explaining something. So those are 2 types of synthesis writing you will be doing. So again, concepts. You will identify a lot of concepts when you do evidence synthesis. Keep a note of them, then categorize them. Categorize the ideas, what you have synthesized from the results of each study. Group them, group the ideas, and support the concepts with evidences in every level of that. Then dwell. Dwell means synthesis takes spending time with our synthesis itself. After synthesize, go back to the articles and verify it. Verify what you have understood. Is it representable from the research studies? Dwell and review and refine. Sometime you may have to add more. Invite experts to read your synthesis and provide them the articles as well, so that they will be able to make a comparison and validate, summarize. Then finally you summarize and write a report. Points to remember: do not force relationship, because it's a systematic process. It is a research itself. Systematic review is the first step of research. Therefore, do not force any relationship. Evidence will speak to you. The evidence will speak to you. It will give out. It will open. Only thing you need to really work and read and synthesize. Do your best to highlight the relationship between the sources and the data. Do not ignore any outliers. If there are any unexpected findings, you collect them and report them as well. And then remember, as always, when we do the discussion, we always provide points for, some studies support for the findings you have found according to your purpose. Some studies which may be contrary to your findings. So all that you are synthesizing again in the discussion. Then finally, you write your report. Writing the report, you follow PRISMA criteria. So in the PRISMA criteria, exactly if you follow, this is the gold standard of a systematic review article. So when you write the systematic review paper or article, follow this. So title, abstract, rationale, clinical role of index test, objectives, protocol and registration. If it is a Cochrane review, like a big review, we need to register the review as well. Eligibility criteria, information sources, search, these all things need to be written within the method section. Then study selection, data collection process have to be explained. Definition of data extraction. Definitions may include conceptual definition and operational definition. They have to be included in detail with the specificity. Risk and bias during the review. Synthesis of risk and bias across the article, that's the one thing. Another thing is you are also writing risk and bias involved in your review. Diagnostic accuracy measures. In the systematic evidence synthesis, risk bias may be privacy issue. So that's something you may have to contact the author sometime. When you do meta-analysis and meta-synthesis, you have to contact the researchers. So remember that. So privacy bias, HIPAA violation bias can be there. So diagnostic accuracy measures, sensitivity and specificity under the Cochrane. If you go to Cochrane website, there is a huge training designated for this diagnostic accuracy measures alone. We can go on, talk 3 hours on it. I'm just highlighting right now. Another day we will talk about it. Synthesis of results. And then comes, results. Results is the next section. In meta-analysis, you will report the data analysis and numerical data. Additional analysis, if you have done, then you write the results. Again, provide numbers of studies screened, eligible criteria, all that. So I'm just going to, this is self-explanatory. We have talked all this. Please look at it. If you are looking at for the first time, you might have come across this Prisma checklist. This is the gold standard checklist, should be followed while reporting systematic review. Then the discussion section. Summarize main findings. Main findings becomes your concepts. So main findings, and then discuss the limitations included in each studies. For example, if you see about 30 studies, the sample size itself will vary across the studies. All those things need to be reported. Therefore, readers will know inherent bias. So then you write, what are the bias? Maybe there, sampling strategy, method, how many randomized control trial in the review you had, how many descriptive studies you had, how many, so you associate them with the levels of evidence. So you describe all that, limitations, conclusions, and then any funding if they have. Further, for systematic review, so we have seen what is systematic review. We have seen significance of systematic review in the areas of education, research, and practice. We have seen model for systematic review, and we have seen 7 stages of systematic review, and we have seen in detail and description of individual stages how we do systematic review. Further, I have provided you some useful website. So if you go inside this Cochrane website and AHRQ website, they are the authority for systematic reviews. If you would like to see some clinical studies, go to AHRQ. If you would like to see general systematic review, meta-analysis, go to Cochrane, which is the authority for this subject. So with that being said, I will invite now questions.
May I now request Mrs. Stella to take over the session for questions.
Oh, thank you, Gladys ma'am. Hello, am I audible?
Yes, ma'am, you're
Yes,
audible.
yes, you are.
Good afternoon, ma'am. Ma'am, in the chat box, I found only 2 questions. A general question. Every student or faculty has their dream in their department. Can you say what is your dream, ma'am?
My dream? My dream. My dream. I am a scholar. I am a leader. And I make impact every day in my students' life. That I take pride in it. I can't be without seeing my students. Let me put it that way. I love my students. My dream. I'm an international leader already. I'm a leader. I'm a clinician. I'm an expert. I'm a leader. And I'm a researcher, scholar. I am, my dream, okay. Next dream is that to get a NIH grant. How about that? I have got seed grant. I have external grant, which I am working on right now. Next, my dream is to get a NIH grant, huge grant, so that I can support my PhD students. That's my dream. Also, that is my professional dreams. I know you are asking only professional dream, right?
Yes, ma'am.
Yeah, anything else? In nutshell, my dream is my students. My students' success is my success. Yeah. While traveling and journeying with them, we faculty get lost, you know. In that process, we enjoy every step. And after some time, you turn back and look, you also have grown, you know. So that's the beauty of nursing faculty. I enjoy every day on it.
Thank you, ma'am. The next question is, guess of how much the nursing department will grow and how well the infrastructure will increase all over the world.
In 5 years, we have, let's think about next 5 years, okay? We are anticipating a huge nursing shortage due to this COVID. We are anticipating huge nursing shortage all over the world. And we faculty and institutions have to be aware of two things happening right now in people's mind. One, they are afraid of being a nurse at the bedside because of pandemic. And then another thing is some people are really becoming passionate about nursing because of the pandemic to help people. So these two things are happening right now all over the world. So there is a shifting and shuffling of the profession going on. So number one, there will be a eternal shortage of nursing. Having said that, global nursing, I expect as a leader, it's my own observation, I expect within next 5 years, nurses will migrate from country to country, they will be demanded everywhere. There will be huge demand for international nurses everywhere. That's my own prediction. But AACN, American Academy College of Nursing Institution, has predicted PhD nurses are heavily shortaged right now. Right now, we have oversaturated DNP, oversaturated nurse practitioners, and we have very slim PhD faculty. So those guys, you are doing PhD, you are highly valuable. Your research is so highly valuable. And now in United States, lot of PhD program, government is funding for PhD program development. And I am program director, founding program director for my institution, which is a state institution. And we have just developed 4 years. Now, my students have just finished the first competency exam just now. So they did well. So PhD programs are being started and developed all over United States because suddenly we turn back and look, PhD nurses are really low in number. That is one. You asked about infrastructure. That's a great question. Infrastructure has changed landscape internationally. As Professor Hema said in the beginning, remember she said, web-based, video-based instruction we are providing in place of clinical. American Nurses Association has approved, which is a governing body here, has approved Previously 10 to 25% of the simulation. Almost now some states have approved 50% of simulation hours as clinical hours. And rest of the hours are telemedicine. We are using telemedicine to inform our students. And also virtual simulation, virtual case study, evolving case studies. All these we are involving in the lieu of clinical. So our educational curriculum might change. What do you think? It might change all over. The landscape will change all over. Then about the infrastructure for the evidence synthesis, it is a mandatory now. The libraries have to have all the databases. You know, that involves money. Libraries should have databases housed within the universities and colleges and schools. And your university is very good at it, I know. So they have it. So those are infrastructure. That now the growth of that infrastructure even more now, the post-pandemic era, let's call it as post-pandemic era, it's going to increase. Nursing education technology going to increase. Nursing education clinical technology going to increase. Communication technology going to increase. Teaching and learning outcomes are going to change. You saw United States has already changed their essentials. We are changing curriculum. We are changing syllabus. That's why I just gave you a foretaste of it. So it is changing. Slowly it will trickle all over the world. I know we in India, we read a lot of American textbooks, American curriculum we follow. We follow a lot of, like especially masters and PhD education, many concepts and curriculum designs are from United States, we follow. So it will change as well. So have I answered your question? Anything else you need?
Ma'am, one more question, ma'am. A participant has asked, is there postdoctoral program in your university, ma'am?
Pardon me?
Is there postdoctoral program in your university?
Is it a fourth doctoral program?
Ma'am, postdoctoral program.
Postdoctoral, okay. We do have in other departments, not with us. Nursing, we have just begun PhD. We have planned. We have planned to have postdoctoral fellowship. Now we are doing PhD. Once first cohort graduates, we have planned to have a postdoctoral fellowship. Our PhD program is very unique. Very unique. Because our core curriculum is health equity research. Health equity research we do not have in our perimeter. So therefore our PhD program is unique. And we collaborate with Public Health, College of Education, College of Communication, College of Engineering. Everywhere we collaborate. Now we do have plan for it. Now the PhD, we have different tracks. We have 4 tracks. 1, BSN to PhD. 2, MSN to PhD. 3, DNP to PhD. 4, a student can be enrolled in another discipline, have a degree in another discipline, they can take PhD nursing. They don't need to have a license, they can take PhD in nursing. So we have 4 tracks. 4 track.
Thank you, ma'am.
You're welcome.
Somebody has asked how to do BSN to PhD, ma'am.
BSN to PhD is a 5 years program. Here in United States, students, they are licensed after BSN and then they come, they practice and they enroll in the PhD program. They have to take all the master's courses. They are not provided master's degree, but they have to take core courses and then they transit into PhD courses and they complete PhD. They are not provided master's.
I'm here to present a vote of thanks for today's webinar.
So they finish BSN. The convenience is they can work as well as towards the terminal degree. That's it. They are not provided MSN degree. They take core courses from MSN. They don't take specialization courses. Core courses from MSN and they move on to PhD. That's how it works.
Okay, ma'am. Thank you, ma'am.
You're welcome.
Thank you, ma'am, for the excellent session on systemic review in evidence synthesis. It was a very detailed explanation and the session, ma'am. Now, may I request Mrs. Ruth Saranya, Assistant Professor, to deliver the vote of thanks.
Thank you, Vladimir. Good morning, everyone. I am here to present the vote of thanks for today's webinar. It is such an honor for me to get the opportunity to thank all dignitaries. With warm greeting and immense pleasure on Dr. MGR Educational Research Institute, Faculty of Nursing, I would like to thank our Honorable Founder Chancellor A.C. Shanmugam sir. A special thanks to our Honorable President ACS Arun Kumar sir for providing immense support to make this webinar successful. I extended my gratitude to thank our Honorable Secretary A. Ravikumar sir for constant support to conduct this webinar. I extended my gratitude to thank our Vice Chancellor, Professor Dr. Geeta Lakshmi ma'am. I would like to thank our webinar speaker, Dr. Annapurna Mary ma'am, for enlightening us with their knowledge. Today's webinar was very knowledge and interesting things. It gave deep insight into the topic systematic review, the art and science of evidence synthesis, and also revealed some interesting facts. Thank you, ma'am. I would like to thank our principal, Dr. Hema Vigach, for giving permission to organize this webinar session. I would like to thank our Vice Principal, Professor Geeta ma'am, for her guidance to conduct this webinar. I extended my gratitude to Professor Ragini ma'am and the organizing team to organize the webinar as a successful one. Last but not least, I would like to thank all the faculty members, students, and participants to make this webinar as a successful one. Thank you, Anand. Thank you.
I request all the participants to fill the feedback form. Thank you, one and all. Thank you so much, ma'am. It was a very pleasant experience with your practical point of view. Has shared all the, the contents of evidence synthesis. Thank you so much, ma'am, for being with us on this day. Thank you.
Thank you.